afternoon, everyone, and welcome to the CAQH webinar on how CAQH ProView for Groups is transforming the way Amerigroup Tennessee manages delegated data. My name is Rebecca Beatty. I'm a Senior Marketing Manager at CAQH, and I will be the moderator for today's webinar. Before we get started, I'd like to review some housekeeping details for all those listening today. Today's session is being recorded, and by the end of the day tomorrow, you will receive a link via email to the on-demand webinar that you may share with others. The recorded webinar will also be posted tomorrow on our website. Your phones will be muted throughout the webinar today. All questions should be submitted online. You may ask your question at any time throughout the session. Simply type your question into the right side of the GoToWebinar panel. We will address your questions at the end of today's presentation. Now I'd like to introduce today's presenters. They are Sarah Shelton, Network Data Specialist Lead, Operational Compliance and Oversight at Amerigroup Tennessee, and Becca Sandler, Product Manager at CAQH. I will now turn the presentation over to Becca.
Thanks, Rebecca. So before we dive in on the ProView for Group solution, I wanted to give the audience a background on CAQH. So CAQH is a nonprofit organization with a mission to streamline the business processes in healthcare in order to reduce burden on health plans, providers, and patients. We are an alliance of 12 health plans and 2 related associations, of which the input helps us guide the development of our collaborative initiatives, such as the ProView for Group solution. So at CAQH, we have 3 categories of work that we perform. So the CAQH core solution is develops operating rules based on electronic transmission of claims-related data between payers, providers, and vendors. The CAQH solutions category focuses on technology-based industry-wide utilities to address some of healthcare's most pressing challenges. And lastly, exploration focuses on research and collaborative efforts which measure industry adoption of electronic business transactions. Before I dive in on the CAQH ProView for Group solution, I want to just highlight our other solutions that we offer here at CAQH. So we have several focused on healthcare provider data, such as ProView, Direct Assure, Verified, Sanctions Track, and Enroll Hub. Many of these address the provider data problems such as collection, accuracy of provider directories, standardizing the PSV process, and maintaining information on provider disciplinary actions. So at this time, before I go through the agenda, we do want to launch a poll just to understand who is on the phone and help us guide our content and focus for the rest of the webinar. So shortly, you should see a poll on the left side of your screen. Please let us know if you have any issues within the chat window. All right, great. So to overview what we're going to talk about today, I'm going to talk about the industry-wide challenges with maintaining and sharing delegated data and focus on how the CAQH ProView for Group solution addresses these industry challenges. At that point, I'll introduce Amerigroup Tennessee. Sarah Shelton's here to share her experience with the CAQH ProView for Group solution, what the Amerigroup process looked like before the adoption of the new solution, and the outcomes of adopting the new solution and how it's benefited the organization. As Rebecca mentioned earlier, we will leave time for questions at the end, so please actively submit those through the panel on the left or the right-hand side of your screen. Challenges of sharing delegated group data. The challenges exist on both the plan and the group side. So for the plans themselves, they're receiving data in varying formats and varying frequencies from their groups. So they might receive a change report and a full roster from each group at different times throughout the month. Roster files themselves often contain inaccurate data, so the groups are having difficulty maintaining good data, and so the plans are receiving that inaccurate data. Oftentimes, groups are submitting files that are not applicable to every health plan, so the plan is forced to filter through what is applicable for them and not. Other existing challenges for the groups are that they're having to maintain all these different rosters and change reports in different formats for each health plan. So the manual maintenance of these reports is painful, as well as once they send them, they oftentimes don't receive any confirmation that the data was processed or received. This prevents them from completing downstream steps that are critical for claims processing and directory maintenance. So the overall result is that plans and groups are not realizing the full benefits of delegation to begin with. So there's excessive resources involved on both sides. The groups are maintaining a lot of full-time employees just to maintain the change reports and rosters, and the health plans are also have a lot of resources on their side to read through these files of different formats and make updates to their systems. Because there's manual entry on both sides and no standard format, there are error-prone entry for the data, and therefore the data itself becomes poor quality, and results in plans performing time-consuming QA just to make sure the data is accurate before uploading. Because of this, the poor data quality flows downstream to the provider directories, and there's no ability to automate on a standard format, and therefore this manual nature with excessive resources and poor data quality continues. So CAQH brought together plans and groups to build a solution that meets both sides. So we conducted initial analysis with our CAQH member plans and looked at all of the files that they're receiving from their delegated groups to understand the common data set and the critical data set. Following that, the plans provided us with a list of delegated groups to go and speak with to make sure that this data elements list met their needs as well as the plans. In addition, the groups had significant say in how we design the solution from their perspective. So what are their business requirements? What are the values that they need to get from the system so we can make sure that it meets their needs as well? So CAQH conducted over 150 phone calls with these groups and has been having ongoing discussions with our member plans to make sure that the design we're about to walk through meets all stakeholder requirements. We also launched a beta in the summer of this summer with 9 health plans and 13 delegated groups to allow these stakeholders to interact with the solution and make sure to further refine the solution to meet everyone's needs before our market launch today. Ultimately, what we've built is a one-stop shop for individual and provider group data through the CAQH ProView platform. So now groups and individual providers can come to one portal and update their information for all health plans to come and receive. How does CAQH ProView for groups work? So what happens is a plan will invite and subscribe to a group. So an email will go out inviting the group to join CAQH ProView, and the group will then be able to upload a new roster to our system. And we'll get into the details of what this roster looks like, but it is a standardized roster for all health plans to receive. The group is forced to fix any errors found by a large sample of 120 quality checks with that standard roster before they'll actually be able to submit it to the system. Once they've submitted it to the system, we auto-calculate a change report, removing the burden from the group to maintain a separate change report from the full roster. The plan will receive email notification that the roster is ready and can then download either a full data set, so what we call an extract, or the change report that's been auto-calculated. Once they do that, they can process the updates into their internal systems and directories and move forward until the group submits the next roster. So what these features provide is a cleaner provider data experience for both groups and plans. So through the standardized roster, the plans are receiving only plan-specific information. So the groups are able to indicate within the file which data is affiliated with which plan, so that the extract and change report going to a specific plan are only for them to see. In addition, because of those quality checks that I mentioned, no longer do we have all of this bad data flowing from a group to a plan when maintaining these rosters. So the solution prevents that bad data from flowing downstream and improves the accuracy for the plans. Lastly, with a standardized approach and output for the CAQH ProView for Group solution, we've enabled easy integration and automation. The groups also receive numerous benefits from this solution. So with that standard roster, it's simplified their maintenance of this data. They can now maintain one file for all their health plans. In addition, we've standardized the data set and terminology so that when we label a field one thing, we know as an industry what it means and what the expected format and frequency of updates within that field are. In addition, they can always come to the CAQH ProView portal and download their latest and greatest data and just make quick updates to submit back to us for sharing with the plans. So they no longer have to store these on 600 different locations within their F drives or whatever it may be on their local computers. It's all saved within the CAQH ProView platform. With this simplified portal, there's also a lack of confusion on where the roster needs to be submitted and when. So now all health plans can come to one place. The group understands they no longer need to send it through email or a specific health plan portal. And in addition, it's offered at no cost to groups.
Becca, we had a couple of questions come through. One is about Whether a copy of the presentation will be available, absolutely. We will email a copy of the presentation to everybody after this. We also had one question, if you could just clarify what you mean when you say a plan versus a group.
Of course. Yep. So, for example, a group in this context for the CAQH ProView for Group solution is a delegated group which has an arrangement with the health plan that states that the group is responsible for performing the credentialing step in the process of provider enrollment. So the group is maintaining that credentialing step and just sharing directory data, delegation oversight, and enrollment information with the health plan on an ongoing basis. In terms of a plan, what we're talking about here is that health plan in that delegated arrangement. So the health plan that has delegated the responsibility of credentialing to a group, and that is the health plan that would come to this portal and retrieve our standard output for this delegated group roster. Any other questions, Rebecca?
No, not right now.
Okay, so here you can see what the group would experience when they're submitting this roster. So they can upload that one roster on an easy-to-use portal, and the system will automatically calculate the change report by comparing their old roster to their new roster. So this ensures the change report is 100% accurate from a termination, an adds, and an updates perspective, so updates being just one-off field changes. In addition, like I mentioned earlier, the group, once they click upload and enter a file name, they'll receive an error report if there's any additional errors that they need to correct before they're able to save it to the solution. So the single format really allows groups to pull data directly from their provider data management system should they choose and directly integrate with our standardized file format. In addition, there's a great feature to the solution which allows a group to see the exact date that a health plan has downloaded their data, whether it be in the extract or change report format. So they can see the exact date, the exact file, even retrieve the file for their own maintenance so that they can make sure that they understand what the health plan has received and that the changes were accurately transmitted. In addition, for those checks that I mentioned, this is a sample of what the error report would look like. So they receive a detailed line-by-line capture of all the errors we find. In addition to that, they are provided the exact tab within the Excel format and the exact fields that were impacted by that error. So it's almost like a checklist for them to go line by line within their roster and make changes before they try to submit again. These errors kind of fall into three categories. So we have formatting, requiredness, and data rationality. So formatting includes that it has to conform to an Excel format with 3 tabs, specific column headers, specific field formats, and compliance with reference tables. So where possible, CAQH ProView for Groups standardizes what a field value can contain. For requiredness, with this industry standard data set, all the plans and groups that participated in the design of the solution agreed which fields would be required and those that would be conditionally required, if applicable, as well as those that are optional. And that is always enforced every single time a roster is uploaded. Lastly, we have data rationality. So there can't be duplicates of any kind within the providers or the practice locations listed. If a provider is listed at practicing at a location, they must also provide the details of that location within the roster file. What we found through a survey of our existing plans and groups is that 72% of the common errors they were experiencing prior to the CAQH ProView for Group solution have now been prevented with these quality checks. So we're already preventing 72% of the data quality issues from flowing downstream into provider directories and otherwise within the plan systems. In addition, with this standard format and standard data set, with our 13 early adopter groups just converting to the standard format even before going through the quality checks, there was data quality improvements. So they've been able to clean up duplicate practice locations they've been sending for years, updating taxonomy codes to be applicable instead of potential typos that were there before. All of these encouraging the plan to be able to automate some of these updates. You can see on this slide that this is what the plan can experience within the PO portal or the participating organization portal of the CAQH ProView for Group solution. As a plan, you can log into one location for both your individual and group information within that CAQH ProView solution. You can also be certain that only plan-specific data is delivered to you from the group solution. When the groups submit that roster, they clearly indicate which health plans should receive which data. And so that is then going to be filtered so that when you download either that change report or that extract, you will only get data relevant for your team. That should speed your updates because you're no longer filtering through irrelevant data. In addition, you have the option for automation. Data is currently being delivered in a standard Excel format and also will eventually be available in a JSON format to make it even easier. In addition, you can see all activity of the groups. You can see each time a group confirmed a roster, as well as some key identifiers about that group, such as an admin email if you would need to contact them for any questions. All of this is an on-demand in a one-stop shop format for you as a health plan.
Okay, Becca, we had a few more questions come in that I think would be good to take now. There's one question about this being specific to Tennessee, and are there any plans that are rolling this out nationally?
Yes. So this is not specific to Tennessee. Amerigroup Tennessee is helping us today just to share their story, but certainly we have some national plans that are already rolling this out. So this is available nationally, and any of your groups would be welcome to join. This standard data set is not specific to a single state.
There was also a question about the data fields required and if we have the CMS required data elements for Medicaid.
Yes, so we do have many of them. We're actually in the process of enhancing the roster to include even more. So we can certainly reach out, and if you want to contact the sales@caqh.org email address, we can certainly provide you with the specific fields that we do support with the roster format.
Okay, and then there was one other question about whether there are any states that have subscribed as a group to post their Medicaid provider rosters.
It's a great question. So we have not had any states as part of the beta process. So with market launch today, we certainly plan to go out and encourage as much adoption as possible to make this a one-stop shop for all plans and all groups. But certainly we'd be excited to talk to you about that if you're one of those states interested.
Okay, great. So we're getting quite a few questions. So I think we're going to continue with the presentation, but we will definitely leave time at the end to address additional questions.
And lastly, just before we move on here, is to emphasize that these extract and change reports are always available on demand. So as soon as the group submits their roster, we calculate that change report, that extract becomes available. You can come that moment, or you can wait a few days because it's not part of your workflow yet. So these files now live forever for you to reference, and that helps with your team such that we know that this is not the only job you have, and you would maybe want to come at your convenience to download the files. In addition to that, we're not just going to recruit you as a health plan. We want to make sure that we also support your onboarding of new groups. So the solution itself is self-service, so we made the user experience as easy as possible, but we also recognize that these groups may be new to CAQH and CAQH ProView. So we created a library of recruitment materials to help share with your groups, in addition to having a dedicated team that can conduct outreach to groups on your behalf and can help that kickoff process to get your groups on board. Here you can see the groups that are already participating, the wide range of geographic areas, size of groups. We have some that are hundreds, some that are thousands. So we've made sure to include a wide variety of groups within our solution design such that it meets all stakeholder requirements. In addition, we also have the member plans that I mentioned earlier, some examples being Anthem, Centene, several Blue Cross Blue Shield, and Kaiser. What we've been hearing to date from our plans and groups that have adopted is that this is easy to use. It's great to be able to come to one place. I don't have to wait for emails. In addition, the groups are particularly enjoying the fact that they can check for errors within their file using our quality checks. So they're able to self-service that fix and know that the data they're sending to you as a health plan is high quality. So now I'll turn it over to Sarah Shelton from Amerigroup Tennessee to share her experience implementing this with her team at Amerigroup Tennessee.
Thanks, Becca. Hi everyone, this is Sarah Shelton. I am the Network Data Specialist, lead for Operations Compliance and Oversight. I have been with Amerigroup for about 4 years, or a little bit over 4 years, but I have worked in the provider data sector for about over 20 years. I'm happy to speak to everyone about our experience that we had through CAQH and getting the ProView groups set up and tested. The previous roster process that we had was probably similar to like a lot of you all in that the delegated entities would submit their data to us via an extract. They would usually be an Excel version. They would email us that information to us and on a monthly basis. We also required a quarterly full file be submitted to us too. Amerigroup had a standard roster format that we used, and we would have liked all the delegates to use as well. But we noticed that the larger groups had problems populating their data from their system onto our template. So as long as, we accepted their data, as long as the key fields were available on the spreadsheet. And if they weren't, then we would have to, of course, reject the spreadsheet back to them, which would delay getting their data loaded into our system. However, the smaller groups could use our template format and submit it to us timely as well. Once we received the roster from the delegated entity, we would assign that item to a NDS associate who would maintain that data from then on out. They would make sure that the fields were correct, that the data fields there were no missing data information, and no errors. Once they reviewed that spreadsheet and verified that the data was loaded correctly on that spreadsheet, they would then have to copy and paste onto another spreadsheet for the data to be uploaded into our system, which is a little time consuming for us. And it was, like I said, if the delegated entity didn't submit us the correct data to begin with, or missed data that we required to have uploaded into our system, it delayed everything and caused claims issues to data, issues. The members didn't get the up-to-date information as needed. Some of the challenges that we had, the biggest was that we received different layouts. As I stated, we might have, a smaller delegated entity would submit it on our roster template, while as a larger delegated entity would send it to us on a different format. The columns were different. We had to go in and search for data. So that was a little kind of nerve-wracking at times. Another challenge that we saw is that where to put the files. We always had a central location to save the files down onto our network into separate folders. As the team grew, we found out that not all the team members had access to every folder that they needed. So we created a SharePoint site. Well, then we would forget to upload the rosters. Then when we needed to look for the rosters, we couldn't find them because they're in someone's emails, or just it got deleted by accident, or was misplaced in another folder, or moved somewhere else, or someone just kept it on their personal computer. So when we had to do a full roster comparison to review the data, we had to go to them and ask, hey, where's this roster? We need this. So it was a little time consuming on our part to have to track down this information. You want to have the data, personally, I would rather have it just right at my fingertips, able to touch it and be done with it. Another issue we had were secure logins. If a associate who managed or maintained a roster update was out for a week and they had the login to access that delegated entity, and the person who was covering for them didn't have it, either when the person who was assigned to it comes back from vacation and tries to log in, they might be locked out because the associate covering for them didn't have the information. Or the password would change. So the different logins and different passwords for each different delegate was very hard to keep track of. Another thing is that when we, like I stated earlier, we require a full file on a quarterly basis. Most of our delegates would submit to us our full data timely. Within a quarter, they would give us this information. However, we had our few that we had to beg for, so to speak. We would start emailing them before we wanted to start the audit, and it might take them 2 weeks or longer to get us that information back. So it put a strain on us as a health plan that we want to audit the data to make sure we have the most accurate information. But if you're not willing to submit that information to us so we can check your data, it's that, that was a little bothersome to us. And finally, again, it goes back to the formatting of the rosters. We had to, copy and paste from one spreadsheet to another spreadsheet, and then submit it up to have it mass loaded into our system. It's just the time of how long it takes from point A to point B. Definitely with the ones that are the large delegates, you had so much data to go through and review. It just took a lot longer to do it that way. So why did Amerigroup choose CAQH ProView? Well, as Becca stated, it's a one-stop shop. You have your hands on, you have not only the practitioner data applications, but you now can access the delegated entities. It's easy to download. It's there at your fingertips. That's what I like about it. You have one login. Even if you only manage, so you manage 2 of your 5 delegates, you have that same login for both of your delegates, and someone could easily cover for you as long as they had access to the CAQH ProView system. So that we love that. You don't have, hopefully you won't forget your login, but it's easier than having 5 different ones. We can access the data anytime we wanted to. We could access a full file today, and then come Monday we can go back and access another one. So it's there at all times. We can go and retrieve data whenever we want to retrieve it. We get notifications when the change files are available. So we can, once the change files are available, we can go and log in at that time, or wait a week and grab the data. The best part that I love is everything's in this one format. You can have 5 delegates, and all 5 delegates have the same exact format. That NPI is going to be in column A with, delegate A, B, and C. That is something that we've always wanted to get all of our providers and our rosters to that point. And this is very easy to determine, what tab has what fields. That's the only thing you'll have to keep in mind, that you know which tab to go to. But it's the same format from, like I said, from each delegated entity. Another thing is that they have checks and balances. They have the quality checks. Not only does it look at the quality of data, is the provider at the right location and so forth, through the CAQH system, but also, a provider can't be submitted for us to download if it doesn't have an NPI number, or if it doesn't have a tax ID number. So that's one less thing, our team has to worry about if it's going to be missing that information to load the provider. So what's changed within our process? There's a lot of it that's kind of stayed the same, but the biggest thing is, again, the delegates would have to upload their data to the CAQH system in a format versus submitting us directly to us. We still get a notification saying, ABC group has a change file available, go download it. But the timing of everything is a lot smoother, a lot quicker. That one associate still works at one roster and then uploads it to our system instead of having to copy from spreadsheet to another spreadsheet to another spreadsheet. It's all, we can use that one file and submit it to have loaded into our system. What are some of the benefits that we see? Less manual work, by all means. Like I said, the copying and pasting from one to another, to moving the file here to saving the file in another area. We're dealing with one standard format now. It's so much easier to maintain and to view, and to know what you're looking for and where to look for that information. Again, the associates have one login. There's no more secure logins it's a secure login, but you don't have multiple logins that you have to remember. I mean, we don't want to write them down to remember them, but it's easier to have that one information to log into. My favorite thing is it stores up to 2 years of data. So when you get the email, I know this has happened to us several times, where we get the email saying that, a delegated entity submitted the data. Well, you have from 24 hours to, a month to have access to that data. But what if you're out? What if someone can't get to work with that data until after the expiration date? Well, as a CAQH ProView system, you have it up to 2 years. I love that, because I love to save data. I want to make sure I have the original data to if I make changes to it, then I can go back and get the original, repull the original. So it never expires. There's never an expiration date to it. It's faster to process full files. But like I stated before, is that it could take up to 2 weeks to a month or longer to get a full file from some of our delegates. And with that, through this process, we put in login, we put in the date of when we want to have the data, or the date, like today's date. We put in today's date and we click a button, we have the data. So we know we can start our audit process right then and there. We don't have to work around our schedule to see when Joe Schmo is going to submit us the roster template that we need a full file for. Another thing is, again, it's all in the same format. It's easier to work with when everything's, step by step, everything is very similar to each other. So it's one format for all delegates. No matter if you're pulled in to work another delegate that you don't normally work, you still will have the idea of the fields. You know where to look for the data. Again, the quality checks that the CAQH ProView system puts on, not only to the actual provider group who's submitting the data, but also they have the data extract where they will review to make sure the address information is correct, to make sure the provider is still active and stuff like that. So finally, some of the lessons learned: patience. We must have patience. That's something that I personally struggle in day to day, but patience not only with the groups themselves, but also with your team. I know that we still have one of our delegates who has a very complex model has I think 20 to 30 tax ID numbers that's contracted through us. They're still inputting data into the CAQH system, and we have yet to test their data during the beta testing. And that's one reason why I wanted them to get set up through this process to view their data and to have access to it. So the bigger the groups are, the longer it might take them, depending how good their data is. They need to scrub their data up front before they submit it to you. So you don't want to have bad data coming from them and then load bad data into your system as well. The smaller groups, of course, were a lot quicker. I noticed that one of our smaller groups during the beta testing, they had a test file that same week we went live with the beta testing. So we were able to see very quickly what the whole process was going to be like, which was really neat. Another thing to definitely consider is to review a full file before you start getting change files in from the delegates. You want to make sure that you are looking at apples to apples versus apples to oranges. For example, if you have in your system that the provider is a pediatric doctor, and on their full file they'll say pediatric and internal medicine, for example, you want to make sure your system has an internal medicine added as well, because you don't want to wait 2 weeks later they say, oh, we're not going to see pediatric patients anymore, let's take this specialty off. Well, if you don't update your system to make sure it equals, then you'll say, wait a second, that provider we didn't have them listed that way. What did we do wrong? Did we miss something? Did we miss a file? Did they miss sending us something like that? So that was kind of, you want to make sure you do a full audit of not only just the names, but the addresses, the specialties, all that information is a big thing to do. And lastly, this is not on the slide, but I want to say that during our beta testing, there were some fields that we thought would help us perform the roster comparisons, the roster updates better. And CAQH is so great about, wanting to hear about the challenges you have, the enhancements that could help better not only you, but it could also better additional health plans as well. So we asked them to think about adding some additional fields onto one of the change tabs. And hopefully by the end of November, I believe, is the deadline or the implementation for that. We're going to have that. So just because you think it's not going to work, tell them what offer up what you think might need to change, or if I needed this, can you add this to the field or add this to the spreadsheet? And they'll work with you to get it to that point. So it was it's been very helpful for us, for sure.
All right, thank you so much, Sarah. We have quite a few questions that have come through, so we will do our best to get to all of them, and if there are any we aren't able to address, we will follow up with you afterward to make sure that you get your questions answered. So first, Sarah, for you, someone on the call would like to know if what was the biggest challenge for your provider data staff in using CAQH ProView for groups?
I think the biggest challenge for them, and still is a little bit, is just getting used to the format, because on the change files or even the full files, you have separate tabs. Normally, when we would process our data, we would have one tab that housed all the data. You had the name, tax ID, NPI, address, all in one sheet. Well, the CAQH ProView system breaks it down into tabs. You have locations, and you have providers, and you have provider locations. And just understanding how to map and link those together has been the biggest pushback I've heard from the team. But it's something that they're working through. They're understanding it day by day when you download on a new roster of how to do that. So it's very helpful.
Great, thank you. So some more questions for you, Becca. First is there a set number of users per delegated group?
Nope. So right now we're supporting one group admin per group, but in an upcoming release, we're going to support as many group users as they would need. So they can, as an admin for a group, they can add additional users, invite them to the system so that multiple people can log into that same group profile and submit rosters.
All right, great. If your plan already has ProView, is this an included benefit in your annual fee, or is it separate?
There is an additional nominal monthly fee for the ProView for Groups solution, so it would be above and beyond the existing ProView cost, but it is free for groups.
Okay, great. How can plans ensure that they are getting timely and accurate info?
So in terms of the accuracy itself, so we run the 120 quality checks every single time the group submits a roster. So it's not just the first time, it's every subsequent time that we receive a roster from a group that we run those quality checks. So every time we'll run them and prevent them from saving the data to the solution if there's any errors involved. They cannot submit. So you would never receive an extract or a change report with those errors that are being prevented up front. In terms of the timeliness, you would receive an email as soon as the group submits the roster to let you know you can go and retrieve whichever report you would want. Right now, we have several beta groups that are actually submitting rosters every 2 to 3 weeks because it's so easy for them. So with the standardized solution, we're actually seeing more frequent updates than the rest of the industry, which is averaging around 1 to 2 months. So in terms of enforcing a frequency, we do not enforce one right now, but we're actually seeing a pretty active use from our existing groups.
Great. There were some questions about NPI, duplicate NPIs. So does the quality check include no duplicate NPIs, and check that against NPPES? And if there are duplicates, how do we handle that?
Yes, so one of those 120 checks is actually to prevent duplicates. So a group can no longer submit 2 providers with the same NPI to you in a roster. We're not currently linked with NPES at this point, but certainly a future enhancement that we have in mind.
Okay, great. So there are some questions about the people currently using the system. So if we could go back to the slide that shows the beta testers, and then there was another question about how many health plans in Tennessee are using CAQH ProView besides Amerigroup, and maybe we could just talk a little bit about the other plans that are also using the system.
Yep. So the first question was, sorry, what was the group question?
The first question was just to show the...
Oh, okay. So these are the groups that are currently using the solution to date. We actually have a couple more early adopter groups that are in the process of submitting their first roster in these next few weeks. So the list is actually expanded beyond this. But these are those groups that have actively been involved in the beta participation. In addition, so we have several other health plans that are national or Tennessee-based in addition to Amerigroup Tennessee. So we have Centene and Blue Cross Blue Shield of Tennessee as well participating already. In addition, we plan to, again, advertise this widely and continue to get more plans on board in that market.
Okay, great. Can a group opt out of ProView?
So of course a group can opt to not use ProView. That is certainly an option for them. When a plan does invite a group to join, like I said, we have a dedicated team here on site, the provider engagement team, to help you explain the value add for the solution, so that we hope that nobody does opt out, but certainly the group is not required to, unless by your arrangement, use the solution.
Okay, great. How often can the data or roster be pulled by the health plan?
As often as you want. So with that on-demand access, you can log into the portal anytime, 24 hours a day, and retrieve an extract or a change report for any of your groups that you subscribe to.
Okay. Is ProView only for reviewing delegated rosters, or can it be used for internally credentialed providers as well?
So right now, the CAQH ProView for Group solution is mainly used for delegated arrangements and that roster submission process. In the future, we certainly plan to expand that capability for helping those internally credentialed providers and provider groups submit mass amounts of data at once to you as a health plan. But right now, the main group participation is from delegated arrangements.
Okay. After the initial retrieval of group info, how would a plan know if there are any demographic changes, terminations, specialty updates, et cetera?
Yes, so as soon as the group submits a roster, if they've already submitted a previous roster, the solution calculates a change report, and that change report will identify any new terminations, any new additions, and any new field value changes, which we call updates here. And that will be accessible to you as a health plan within the portal. You can log in and download a change report that specifically compares the data between two roster submissions. And that is, again, available on demand at your leisure.
Great. There's a group that is asking, how do they get started?
It's a great question. So we have Cam, our provider engagement representative here. What we would ask is that you email the group support at CAQH.org. So that's GROUPSUPPORT@CAQH.org. And we can certainly reach out and schedule a call to get you started.
Okay, great. Sarah, we had another question come in for you. Someone was asking if you can elaborate a bit on when you mentioned that incomplete information is received, and you said something about your team having to comply or complete the roster and send it back.
Yeah, that was for our previous process, is that, when a delegate would submit us information and the data was incomplete, was missing like a tax ID or an MPI, we would submit that roster back to them to have them to get a new roster updated, but it's not the current process now with the CAQH ProView site.
Great, thank you. Someone is asking if they can obtain a list of the current quality checks and see what the current format of the roster looks like.
Yes, so certainly. Again, if you email the sales at CAQH.org, the sales team will provide you with the list of quality checks, the list of data elements, and give you an overview of what that standard format looks like.
Okay. I think there was a clarification on the question about groups opting out. So if a group has already created an account and then eventually decides to opt out, can they? And is there an opt-out form like the one that we have for individual providers?
Yes, so there is a form. It does require that the group contact our operations help desk for us to completely deactivate that account after they've already registered, but certainly there's a formal opt-out process that the group can go through.
Okay, great. How does CAQH handle providers with multiple addresses on a roster?
So within the current roster format, the group can have a provider practicing at as many locations as necessary, and actually even go further than that, say a particular practitioner is at a certain location only for one health plan versus another health plan. So the actual standard, industry standard CAQH format allows for that type of flexibility.
Great. We have a question that looks like from a group that is, they're TPA, so considered a plan, but part of a large healthcare system with employed providers. We've recently become delegated with several plans from our employed practitioners. Do we need a separate account for the group side?
Yes, so if you do have a plan account on the CAQH ProView PO portal, this would be a different account that you would be able to create on the group side to be able to submit your roster.
Okay. We have a question about if a provider's information is already included in the roster file that will be submitted by the group user and the provider has an existing CAQH ProView account, why the need to have a separate, the individual provider still using that CAQH ProView account?
It's a great question. So in a case, sometimes it may be necessary and may not be necessary. So if an individual provider still has an arrangement directly with a health plan, not through a delegated group, they would then need to still maintain their ProView account on the individual side so that they can attest to their credentialing data set for the plan to perform that primary source verification. If, however, the provider no longer has that type of arrangement, then they wouldn't necessarily need to maintain that individual provider account and could instead just continue to have their data submitted on the group roster.
Okay. Does the health plan get notified of changes to the roster?
Yes. So as soon as a roster is submitted, you'll receive an email that will indicate you can go and download changes for your specific health plan.
Okay. What are the different data outputs that a health plan has access to?
Yes, so we have what we call an extract, which is essentially what most of you are calling a full roster. So when that group submits the data, let's say as of 10/3, you would have the ability to pull a full snapshot of their data as of 10/3 for just your health plan, and that would be available in an extract. In addition, there's a change report file that only includes changes between two files. So it wouldn't be a snapshot of the full data submitted on 10/3, but it would be the changes from 10/3 to the previous file. So whether there were new providers, terminated locations, et cetera, that would all be provided in the change report option.
Okay. How does this differ from regular ProView?
So this is different from regular ProView in several ways. So regular ProView, or the individual provider application, is meant for an individual practitioner to log in and fill out the full credentialing application, all of those fields that are necessary to perform PSV and maintain a provider's data within a health plan system. What this allows is actually a group to submit a file with multiple providers worth of data. So a group can come to one place, use a standard Excel format, and submit multiple provider data at once to health plans. In addition, this file does not support the entirety of the credentialing data set since the health plan is not responsible for the credentialing in this arrangement. The group is able to submit a smaller data set that allows for delegation oversight, directory maintenance, and enrollment. So it's a different data set and a different use case.
Okay. If a provider maintains both an individual and group account and the plan pulls both, are there charges to the plan?
Yes. So given that there are different data sets and different sources, there is a charge for each data set.
Would the provider only have one listing per provider on the name tab, but multiple address lines on the location tab?
So without getting too far in the weeds on this example, we have a third tab that actually allows you to affiliate providers to locations. And within that third tab is really where the relationship between a provider and location is established for a group roster. And again, you can put as many provider location relationships as needed to supply to the health plan.
And there's a question about the charge for health plans. For that, we ask that you direct questions to sales@caqh.org, and they can follow up with you about pricing. All right, well, thank you all so much for joining the webinar today and asking so many questions. As a reminder, tomorrow you will receive an email with a link to the recorded webinar that you may share with your colleagues. You may also visit www.caqhproview.org for more information. There's quite a bit of information up on that website. And for any additional questions, please email us at sales@caqh.org. Thank you again. Goodbye.